In the studio with me is James Boone. How are you, sir?
Good, thanks.
James is a physician, internal medicine physician, and addiction medicine. I did not know there was such a thing till this morning.
Yes, sir. It's been around for a while, but
so have I, but I never heard of it.
There are not very many of us in the States that are actually boarded in addiction medicine and certified in addiction medicine. So.
Okay. So what does that mean, really?
So people who are in primary care, either family practice docs, internal medicine docs, or psychiatrists that do an extra couple of years of training in learning how to deal with people who are struggling with addiction.
So if you're a psychiatrist or a doctor, you've already been to school for many years, and now you're going to do 2 more.
It's 2 more years. It's on, it's training, so you're still working with patients every day. And I've been at La Hacienda now for about 11 years, actually, in the next couple of days. Started there November of 2004.
Well,
so,
happy anniversary.
Thanks, sir. Been able to take care of, close to 9,000 different people struggling with addiction. So it's a lot of experience.
Yeah, that's why we have so many celebrities here in the in Kerr County area. They come for, I want to say rehab. It's called recovery.
Recovery, yeah.
And then they just say, hey, this is nice. I'm going to stay here. I had this conversation with my son yesterday. He was saying, I just can't help myself. I do such and such. I said, if you know what, if you got an electric shock every time you did that, you'd stop it after about twice. Twice, I'd give you a max. And he looks at me like, I said, don't tell me you can't help yourself. Now, some of us need that electric shock. We need some kind of help. We need some assistance, so we get away from it all. And that's where La Hacienda comes in. Now, when you're talking about addiction medicine, what does that mean for? Does that mean you prescribe something that makes them not want to be addicted, or how does that part work? It's all still mostly. Is it mostly in your head, or is it physical also, or is it everything?
I mean, there's both. I mean, the physical portion is limited. Yeah, we got to talk before you came on the air about somebody who had been in jail for a while. So,
yeah, they all end up in jail in some kind of trouble.
A lot of times they do, and so if they're in there for 9 months or a year or 2 or whatever, then there's no physical real manifestation left over, but there can still be brain changes that go on really lifetime.
So does consuming, ingesting drugs literally changes your brain?
It does. It literally changes your brain. And we know now that addiction probably, there's a huge genetic portion of that. Maybe up to 50% of that is actually genetic, that you have a predisposition. It's not like I have blue eyes, my wife has blue eyes, we have 6 kids that all have blue eyes. That's simple, what we call recessive genetics. So I'm not talking about that. Okay. So there's like 43 different sites that we've identified that increase your risk of addiction. Uh-huh. So if you have one parent who's an addict alcoholic and you just track those kids, even in adoption studies, so say they're adopted into a 2-parent home, no drug or alcohol, about 15% of the population struggles with addiction. But if you track those kids who let's say their father was an addict alcoholic, so that baby didn't have any drug or alcohol, adopted into a 2-parent family, no drug or alcohol in the home, track those kids for 20 years, 40% of those kids are struggling with addiction, 40%. If both parents are addict alcoholic, you adopt them out, it's 50%.
Yeah.
I mean, so that, there's a true sort of disease portion of that, so it's
that's your nature over nurture thing.
There is. So now, obviously, environment plays some. If everybody you're around is,
availability is part of it. Yeah,
availability. So there's a piece of that that's environmental, but there's another big piece of that. So it's sort of like if everybody in your family has diabetes, your risk of diabetes is higher. Right. Now you can also create that potentially if you weigh 600 pounds and eat sugar all day. You may have no family history of diabetes and still end up with bad diabetes. Right. So there's other factors in there.
There's always a guy that wants to be first. I'm going to start a new tradition in the family.
Yeah, so we see people like, there's no way I have this. Nobody in my family's ever had this. I'm like, no, not really. Works that way with other diseases.
Well, you might not even know also. Many of us have an uncle, an aunt, a grandparent or something. We don't know everything about them, or there's somebody that's fairly close in the genetic chain to us. We don't know anything about it. And then we end up this way, and they go, oh, you're like your Uncle Ernie, And what do you mean, my Uncle Ernie? Well, yeah, Uncle Ernie had the same problem. Nobody told me that. I would have prepared for it.
Yeah. So there's definitely a genetic part of that. And so there's always that thing of people get frustrated. This horrible deal in Oklahoma over the weekend with this drunk driver that killed a bunch of people, and it's hard to have sympathy for that person when there's that kind of catastrophic consequences. And so, like you said, I mean, there are choices involved, and yet at the same point in time, sort of like the diabetic. If you have diabetes, you can't choose to not have diabetes.
Right.
I mean, it's like people go, "Hey, you're jacking with our family. We're going to the doc all the time. We're tired of cooking like this. Get rid of this diabetes thing." Then we go, "I can't do that."
Right.
But they have the ability to say, "Hey, I'm going to take my insulin. I'm going to eat right. I'm going to exercise." And if they do those things, their sugars stay good, and they can be healthy and be an old person, right, and be a healthy person.
And that's what it's about when you go to treatment. You're getting it under control. It doesn't really change you. It just helps you to overcome the thing.
That's what recovery is like, yeah. I think a great analogy really is like physical fitness. Can a human be in really good shape? Is that possible? I mean, watch a D1 football game over the weekend, or the Women's World Cup soccer team that just won that thing. None of those folks were getting in shape. They were perfectly fit, but it was dependent on their exercise and diet, right? What they were doing. And so what we really believe at La Hacienda, what I get to be a part of as a doc, I'm taking care of their medical things, of their liver disease or their hepatitis C or their diabetes, their high blood pressure. Sometimes there's medicines we're helping to do with maybe anxiety, depression, some medicines that can help with alcohol and drug addiction. They're not magic. They improve success by about 30%. But really what we're doing is teaching them a different way to live. And so just like somebody that exercises and eats right, the success rate is 100% if you do it. Most of us are out of shape and overweight, not because exercise doesn't work, because we don't do it.
We don't do it.
Right. And so
we know what to do, and we choose not to.
Yeah, true healthy recovery, it really changes things. And it even changes, there is even brain healing that takes place. So we can do that now with what's called functional MRI and PET scanning and SPECT scanning. There's all these different technologies.
So now, are you saying that if you take somebody when they first come to you and they're a real mess, and you scan their brain, you look at it, by the time they go through treatment, maybe it's a year later, that brain would look different, literally?
It would function differently. So if we just do like an MRI or CAT scan, you can't see that. But if you look at tests that look at function, especially the front part of
they'll get some of it back, right?
They know it can be dramatic.
Yeah. So they start remembering again. They become nice. You can see recovery
out to 3 to 4 years, but probably not just the memory, but so as humans, right, you mentioned at the beginning, you get shocked a couple of times. You get shocked 2 or 3 times in a row. You're going to stop doing that.
Right.
But you see the addict alcoholic, I mean, it's worse than that, It's like prison or a six-pack. And they go, I think I'll take the six-pack and risk prison. I mean, who does that? I mean, most of us, a shock changes your behavior.
But all of us live in some kind of denial at some point.
Well, we do. Yeah, we do.
You go, I'm going to get the six-pack because I ain't going to prison.
Right. Yeah, no, there is this sort of weird justification,
Right. And here's the thing I cannot understand. I cannot get my head around this. They think they must drive. I must drive while I drink, and now that I'm good and drunk, I need to get behind the wheel. What is that all about? I mean, is there something actually in there? Is there some kind of a death wish, some kind of I'm going to prove to the world that I can do it, or what? Why is there so much of that?
There's really not. It's really impressive too, really the last several years, is that it's the front part of our brain kind of underneath our forehead. That part of our brain, the frontal lobe and what we call the prefrontal cortex, that's how we can make judgment decisions. So that allows us to say, heck no. So there's a ton of people that enjoy a beer, that enjoy a glass of wine, and then they go, one night they drink 2 or 3 or 4 or whatever, and they go, I'm not going to drive tonight, I'm going to call somebody. And they make this, because that judgment part of their head is still highly functional. As the addict alcoholic goes deeper into addiction, they literally lose the ability to have normal judgment, impulse control. Remember, he just died, just died pretty recently, but remember Roy Tarpley, the guy that played for the Dallas Mavericks back in the 80s? Yeah, Michigan.
Right.
Roy Tarpley was this amazing basketball player. And back in the 80s, late 80s, I was in residency. Roy Tarpley was Sixth Man of the Year in the NBA. He was making $6 million a year in the 80s. I was making $14,100 a year, working about 110 hours a week, right? I wanted that guy's job and his income.
Right.
He was playing for the NBA. He was Sixth Man of the Year. He had 2 strikes against him. 3 strikes, you're out of the NBA, right? And it's in season. He uses and gets kicked out of the NBA. I mean, it's those things that you go, this doesn't make any sense. At that point in time, with what I thought,
everything for a temporary high,
right? To listen, and you. So I'm going, you're the stupidest human on the planet. Who would do that, right? Until sort of the data continues to grow, that what happens is you lose the ability to have that normal impulse control ability to say, this is stupid and dangerous, and I'm not going to do this now, right? So that's what takes time for recovery, and that's what takes. And what we see is that when you really approach this, we're a 12-step program, and when you really approach life from that, over time, you see healing of that part of the brain, that ability to have impulse control, and so those things help with that. Go back to the jail story. Somebody's been in jail for a year, they get out. You go, surely you learn your freaking lesson.
Well, they're dried out.
They're dried out, and they leave the jail. They walk across the street, and they get blitzed.
Right.
And so what happens, though, is they're not doing anything that helps that front part of the brain recover. And that true 12-step recovery contributes to that.
Now, all 12 steps are not created equal. I've heard from different people, I mean, how it's executed. I've heard from different people that have been in different programs that they've gone to some that all people talked about was how they used to get high. They kind of relived the experience. Even that in the wrong hands is not going to help somebody recover.
It's of no value. Yeah, it's all dependent. It's like, go back to the exercise analogy, you know. You say you're going to go to the gym and work out and just walk on the treadmill for a minute and a half and look at girls and curl 2 pounds 3 times and then leave and go, I don't know why I'm not getting in shape. Well,
I want a Diet Coke and a piece of pie.
Yeah, like, well, you didn't do anything, right?
Right.
And so true 12-step recovery is hard, and but it changes your life.
So you got to be ready to do it. And so part of the deal is some people get nabbed, and so now they got to go through treatment because they got themselves up to their hips in legal problems. They got to go through the process, or their wife or husband's going to leave them, or their kids won't speak to them anymore, or whatever. That's not really the right motivation, then, is it?
You know, those external motivators, we get a lot of those people that come in, and they come in sometimes pretty angry and really not.
I have to do this.
Yeah, but here's the other thing that happens. It's a fair number of those folks that does happen to. Some of those people stay angry and leave angry and go back and do whatever they were doing. But a significant number of those people, a little bit further on, sort of the light turns on, and there's a sense of going, wow, I have been really destroying my family and destroying my life, and I do want to do something different. And so it varies, but at least half of those people you'll really see, probably more than half, you'll really see give a really solid effort. So those intervention things and how to do that, it's complicated, but ultimately you're right. You've got to want it. You've got to get to a point where you go, I'm willing to do whatever it takes to do this.
Doing this for me.
Yeah.
Talking to Dr. James Boone at La Hacienda out in Hunt. People are so complicated. You have to deal with all this stuff. I mean, the baggage. You find out things about people because of their genetics, their past. You have to overcome what you were just describing to me. Sounds like you're overcoming somebody's pride. Somewhere along the way, they have to admit and just buckle under and go, okay, you're right. I'm screwed up.
Right.
So you deal with all those different components. That's got to be. How often do you have a martini? Is what I'm asking. You might have a reason to drink. You might have a legitimate reason to get blitzed occasionally. And
you do hear people's stories, and there's some.
How do you remain detached enough you don't want to jump up and grab somebody and go, you need to wake up here? There's
some rough there's some people that have gone through some incredible stuff in their life, and come out surviving. And
but that's the other thing about humans. We're very resilient.
We are resilient.
We'll roll through. I mean, it's like a bulldozer goes over you and you get up and go, I'm good.
Yeah, it's amazing. And so you can see people with just horrific childhoods and crazy stuff in their past. But there is resilience, and when you really work with people that can help you go deep and help you go there in a safe place and help you deal with some of this stuff. And then as you kind of live out a 12-step recovery program, you go through it. You go into a lot of different things. And sometimes people there may be some people, 20 or 30% of our folks need some other psychiatric medications. There is major depression or
that's a balancing
generalized
act.
Anxiety. And that's
you got
a
somebody
balancing
came
act.
off of drugs. Now you're going to put them on drugs. That must be pretty difficult.
So there's very specific medications that we know are safe, that don't have any abuse potential. So, there's a lot of stuff out there that nobody ever abuses their, amoxicillin prescription and goes, gosh, I just love this stuff, because it just it doesn't do. So there's meds.
I'm jonesing for a little amoxicillin.
So there's meds that are safe options, but there's a bunch of medications that people try to use. They think what they're dealing with is, this is all anxiety, this is depression, this is my mom, this is my dad. Most of the time, it's just alcoholism or drug addiction, and it's a matter of addressing those issues. But sometimes you got two different things going on. So you go, hey, we got to address your addiction, but we also have to address your major depression. So we are going to be working. You're going to be seeing the psychiatrist while you're here. You're going to be working in that area. You're going to be seeing the counselor working on that. We're going to be addressing the addiction from this angle, looking at these things. And so there's a lot of layers that get uncovered while you're in there. And it's the beginning. Most of our folks are there anywhere from 3 to 5 weeks, and you got 28 years of stuff in your life that didn't get fixed in 3.5 weeks.
Right.
But it's the beginning.
You don't even think right till you kind of detox.
No,
do you?
you don't.
Yeah. It's a difficult process. La Hacienda has dealt with it for a long time. You're an addictionologist, literally an addictionologist.
One of the names, yes, sir.
There's not a lot of them, are there?
No, there's less than 5,000 as far as just kind of board-certified addiction medicine docs in the U.S. So with the population, about 15% of the population struggles with addiction. So that's a bunch of people that, and docs. There's a recent article about early prescribing of like opiates, pain pills in kids in high school years and younger, and how that increases the incidence of addiction. And so, docs, we've been a part of this problem. We want to try to fix people, and they tell us if they're hurting or they're anxious, and there's meds that we can give them that take them backwards, that don't help them. So we can be a part of the problem also as a physician standpoint.
Well, there was this news story yesterday, you probably saw it, that said that about 69% of people that are on some kind of antidepressant don't really need it.
Yeah.
They just hit a low spot and they got a prescription, and now they're on the stuff.
Right.
Yeah.
And the antidepressants, if you look at, placebo is pretty amazing medicine. I mean,
I was addicted to placebo, but I got off of it. Yeah.
Placebo's effective. It's 40% effective for depression.
Really?
I give you a red Skittle, and you're convinced it's going to help you. It's our brains.
I have to take that. The doctor said so.
So
I knew a guy that his doctor prescribed him for his kidney ailment a beer a day, and that's all he would drink, a beer a day. But he was happy about it. Had permission to drink 1 beer a day.
That guy had a busy practice.
Yeah, he was. Well, this is not the kind of guy that would have ever had a beer. He was a happy guy.
Yeah.
It's basically all 12-step programs are your body, mind, spirit. Is that correct? Okay.
Yes.
Because you got to get everything. You got to look to somebody outside yourself.
Yes.
The higher power.
Right.
So that's a component in it. I'm sure you have people that come to you that have lost all hope in anything. They've lost hope in mankind, or that there's anybody out there that cares about us or anything. So that's another challenge.
It is a huge challenge. That's where a healthy recovery community is pretty amazing. When you get a bunch of people who have been through it, that have been in the same dark place that you've been and have come out the other side, and are willing to kind of pour their life into yours, and they can go, I've been there, and You got 5 or 6 people that have been there and are willing to kind of come stand by you. I mean, I don't care if you're going through a cancer treatment or what that is.
A special kind of people that come back to the scene of the crime, so to speak.
Yeah.
And say, I'm going to help this guy out.
That's a part of healthy 12-step recovery, is that you're going to continue to pour your life into other people who are struggling. And that kind of keeps the reminder for you, hey, if, sort of but for the grace of God, there go I. I mean, if I don't, if I kind of drift away from this work, this spiritual, emotional work that 12-step recovery is, I'm going to be right back where that guy is. And so when they get to work with them and get to help somebody else, not only does it help their own recovery, they're helping somebody else, but they're also helping themselves at the same time. So
that makes sense.
It's a great way to live your life. I mean, if you just even Wikipedia 12 steps and read all of those things, there aren't many humans that couldn't go through there and go, seems like I ought to do that. I mean, there's not one part of that you don't go, that's a pretty good way to live your life, So
yeah, helping other people and keeping on the straight and narrow.
Yeah, it's a rewarding thing to do. It's a sad thing to do, when you see people that just continue to relapse and don't follow through. We see people that obviously die with their addiction. And
the first time you saw one of those, did you feel like a failure?
No,
you got yourself to think about too.
Yeah, no, I don't. I think you're dealing with an illness that I mean, it basically takes people either to the hospital, to the deathbed, or to the prison.
Right.
And so if we're trying to help them halt that process. And
sometimes it takes them to all three, doesn't it?
Not uncommonly. I see that progression.
Right, and you're trying to help them every step of the way, and then you feel like it's wasted time, energy, money, emotion.
Yeah, I think we all do that in medicine, though. Whether you're treating the cancer patient that doesn't make it or the heart patient that doesn't make it, I think for us as professionals, whether that's in our counseling staff, from us as physician, the nurses that are out there, I mean, we get to know those people really well over a month time, and there are some bonds that are formed in there, and it's definitely sad and tragic for us when somebody actually dies with this illness. But also we get those emails and visits back, and this day before yesterday, a young man had came to pick up a 2-year sort of celebration chip, what we call a 2-year chip of being clean and sober for 2 years, and just life totally turned around, and just excited about. I mean, you get those pieces help actually fill in the sad parts when the patients don't do well. So
you live a while off that.
Yeah, then I can go, you made my day. It's good to see you. So
Dr. James Boone, La Hacienda, he's an internal medicine doctor and addiction medicine, and actually an addictionologist. So you can tell everybody he learned a new word today. We try to learn something every day on the Harley Show. I appreciate your help. Now, tell me how somebody listening can find out more about La Hacienda.
So La Hacienda there's actually a great website. You can just Google La Hacienda and go on there. Our office, what we call our inquiry call center, those folks will go above and beyond to help people, at least guide them in some direction. We kind of talk about, one of our mottos is for that to be sort of the last call that somebody has to make. If they don't need us, we'll try to guide them to somewhere else, give them names, phone numbers, to try to sort of help steer that family, that wife, that husband, the patient themselves, of how can we help you start to turn this thing around. LaHacienda.com, there's La Hacienda on the internet. Just call, look us up, and we'd love to try to help you in that process for your
everybody listeners. Listening.
So
either involved, has been involved, or has a family member.
Everybody's been touched by this.
Or a coworker. Everybody's touched by this.
Yeah.
And we wonder. I read the news every day, all day long. I read all the news, and I'll read something, and somebody did this, that, or the other, and I fail sometimes to take into account they were probably high.
Yeah.
You see, honest to God, you see these news stories. Somebody does something weird. Some congressman does something stupid, and you go, he was high.
Yeah.
I failed to enter that into the equation, but I'm getting better at it.
Yeah.
I think everybody's high. I've just put that in there as part of the equation, and then if proves to be wrong, then I'll correct myself on it. But at this time, I'm like a cop. Everybody's a perp. I'm just thinking from now on, everybody's high until they prove otherwise. And
it's not for me. It's never an excuse, quote unquote, for bad behavior. I don't see it as an excuse in some fashion.
No, yeah.
And accountability is part of the deal. It's sometimes it takes pain for us to be able to turn our lives around, and so there's accountability for action as part of the thing, but also treatment. That there's folks can get help. You don't have to live like this.
Oh no, I joke about it, but it's a painful thing.
Yeah.
To deal with families that are broken apart because of this. And some of them get to their wits' end and they go, I love this person, but I just can't be involved with that anymore.
Right.
You can call La Hacienda if you reach that point. Look them up online. Dr. Boone, thank you, sir.
Thanks. I appreciate it very much.
Enjoyed it, and I hope that everybody got something out of that.